facial plastic surgery. No, I gotta do that again. Okay, all right. Welcome to the Face Duo, everyone. I'm Dr. Tripathi, facial plastic surgeon in the San Francisco Bay Area.
And my name is Brandon Dunn, and I'm also a facial plastic surgeon here in Orange County, Southern California.
Thanks for tuning in to our YouTube channel. It is the Face Duo, where you get everything on facial aesthetics. So today we're going to talk about preventative treatments. Now, this is a little controversial because there are a lot of treatments that people consider to be preventative, or a lot of things you can do at home that people consider to be preventive. And then there's a lot of stuff that you just kind of have to weed through since there's a lot of nonsense on the internet.
Definitely.
Let's just start off with a few things that we recommend to patients or that we see online that we actually think work well. So what do you want to start off with?
The first thing I'm going to start off with is sunscreen. I think sunscreen is the best thing to start with. It's for everyone. Everyone can start using it at any point, from childhood all the way to adulthood. And there's a benefit throughout the entire spectrum of life. So the biggest thing with sunscreen is it helps to prevent hyperpigmentation, fine lines, wrinkles, just overall skin aging. And skin aging is really the biggest thing that I feel that's the most important. Everything that you do on top of any sort of a facial aesthetic treatment, your skin and how it looks and how it ultimately glows is really dependent on your sunscreen use.
Yeah, totally agree. And I think the thing to remember is that it should be affordable. It's for sunscreen, more is more. You're not trying to just limit the amount of supply that you use. You want to make sure you're coating your entire face with it. And there's actually some data to show that sunscreen actually reverses some of the signs of aging from the sun. So not just that it prevents future damage, that you can also reverse some. So I agree. I'm a firm believer in sunscreen. It's all over both of our social media channels because it is the easiest thing to do. And we've talked before that I don't ever recommend treatments for patients if they're not going to commit to sunscreen, because what's the point? You're just going to take 2 steps forward, 3 steps back.
Is there kind of a basic thing that you recommend when it comes to sunscreen, like a certain SPF or anything?
Yeah, I mean, I generally say an SPF 30 or above. Generally 50 is, in my opinion, a little bit better. I mean, you're getting good protection if you're using 30 and above and you're using the adequate amount. Now remember, the SPF on there is a function of how much you're using. So you really have to use 2 to 3 finger breaths, which obviously everyone's fingers are different. You're squirting out a little bit different on your fingers, but you really have to use enough on your full face and neck to get the benefits of it. But in general, I just tell people to try a bunch of different sunscreen out, feel which one you like the best, which ones don't leave a white cast, which one you feel like, makes your skin feel a little bit nicer, not greasy, and those are the ones that you're gonna end up using. What about you?
I say the sunscreen that you use is the sunscreen to keep. And basically, if you're applying sunscreen, then you're going to be getting a benefit. Ideally, there are certain quantities and qualities to sunscreen that you want to kind of shoot for. So if you're more advanced, I guess, in your skincare, then I would say kind of look into these nuances. But if you're new to this, then I would say just starting with a sunscreen, SPF 30 and above, and just using it every single day before you get out. That's the biggest thing.
Absolutely. Okay, I'm going to take the controversial one.
Okay, let's see it.
So, what do you think about, I'll talk about this, Botox. So, Botox as a preventative treatment is controversial, in my opinion, for 2 reasons. 1, because it actually works, and 2, we don't really know sort of what the ideal age is to start, right? So I tell patients, will Botox prevent lines from getting deeper? Absolutely. If you're not, raising your forehead muscle here and creating lines or around here, around your eyes, you'll prevent those lines from getting deeper so long as you're not moving them. Do you need to start when you're not noticing any lines? Probably not. But the thing to remember is that Botox really does prevent lines from getting deeper, and over time you're going to get that benefit of it. If you stop after 10 years, you'll have had that 10 years of benefit. What do you think?
The other thing that I would say is that Botox it goes beyond just fine lines and wrinkles and what it helps. It's been shown to help with oil production and pore size and skin complexion and things like that. And so there's added benefits to this as well. And so
if somebody is coming in and saying, I have some lines that bother me, or they're starting to bother me, or like in pictures they're starting to bother me, then maybe I will. If I have a patient that comes in that just says, I'm worried about getting them in the future, but I'm not bothered now by anything, then I don't think we need to start.
I agree.
I think a lot of patients come in thinking it's going to be too late, when in reality it's not. I think once the lines are fully etched into the skin and very deep, then it can be a little harder. But in general, if you're starting in your 30s and 40s, most people, it's not, too late.
There's two different types of lines. There are dynamic lines and there are static lines.
Point,
and I think that's important. So if you have static lines, basically you have etched in lines that are there without movement of your muscles, then I would say those are much more difficult to treat. And so this preventative, I would say, are more the dynamic lines that you're talking about. The ones that you're seeing in pictures when you're smiling, when you're moving, when you're animating. Those are the lines that it does prevent per se.
Yeah, I agree. Yeah. That's an important distinction because you'll also have lines in areas of your face that are not treatable with Botox, right? So you'll have lines around your cheeks, for example. You can't really treat those with Botox because you'd be paralyzing a muscle that you need for your face to look normal. But yes.
Wouldn't recommend that.
Yes, would not recommend that part. What do you think about fillers? So people sort of lump Botox and filler together, right? They're both injections. Right. We think of Botox as preventative, but what about fillers? Do you think fillers actually prevent things from getting worse or prevent, signs of aging?
Your run-of-the-mill hyaluronic acid, HA fillers, I would say that they don't. All they do is they provide volume. They help to camouflage shadows, they help to provide fullness, they help to enhance contours of the face. Things like Sculptra, which is basically a biostim, and it basically stimulates collagen production, that can improve skin quality, skin texture, that can ultimately help with the overall aging process, but it doesn't necessarily prevent the ultimate sagging and heaviness. Let me give you an example. So one of the things that I will say is that if you keep injecting your lips with more and more filler, it actually weighs your lips down and it can actually create a longer upper lip. And so that ages you. And so in some ways, adding volume can actually increase the extra gravity and mass of the face to actually potentially...
We have to do this.
We do. We do. It has to be like this.
Yeah.
Excuse me, pardon me. I'm coming through. So if... But so what I would say is that I think ultimately there are fillers that used in a particular way, it can actually add to your aging too. So yeah, I think there's a nuance. Yeah.
You're putting fillers in the corners of the mouth to prevent a crease from forming, and you do that enough to prevent, to support that area so a crease doesn't form. Would you say that that's preventative?
The problem is if you're treating one particular area, you're not thinking about the face in kind of a global sense. So the reason why you're getting heaviness in this nasolabial fold or kind of prejowl sulcus area is because you're getting sagging of the cheek in the midface. And so if you're filling this, it actually starts to look more artificial, I think.
Yeah, and that's a good point, right? That Botox in general, if you overdo it, sure, but in most people it doesn't look artificial. I think people are scared of that frozen look, but filler is, over time, what makes you think of those celebrities that have had way too much. It's not the surgery, it's almost always the filler, I think, that gives you that sort of pillowy, puffy look. So I agree, I don't think fillers are necessarily a preventative treatment. If you're doing things for your skin, skincare at home like sunscreen and retinoids, in-office treatments like lasers and Botox, those tend to be more preventative. Things under the skin, probably not.
I would agree.
Yeah. What are your thoughts on skin tightening treatments? Things like Ultherapy, radiofrequency treatments, things that sort of heat up the tissues that tighten. Do you think that creates any sort of long-term preventative treatment?
I think in the right person, I think they can really help, but they're not life-changing. I would say that I think there's a benefit in my younger patients. I'd say as you get older, if you kind of move into your 40s and 50s and into your 60s, there's just not as much of an improvement that you can truly see. So I would say as from a preventative standpoint, yes, but it's also going to be a lot of money.
Yeah, I think this is a hard one for me. Maybe a place where we disagree. Because I'm always right, so maybe I'm right in this one. No, but
unlikely.
I think it creates a small amount of change, so you get a little bit of tissue tightening per se, but I don't think it actually prevents anything from getting worse with time. So I think of it as a nice treatment to improve sort of laxity and maybe a little bit of fullness in particular areas if it melts fat. But I don't think it's truly a preventative treatment. But you know what? We don't have a lot of data on things like radiofrequency treatments. They're relatively new. So stay tuned.
Yeah.
That's all we have for you guys for this episode. Make sure to like and subscribe to this channel. It's going to be everything facial aesthetics, and we will see you next time.
All right. Take care, guys.